Honorable guest of honor, the increased patient workload has meant an increased need for bed space. The facility was constructed as a 60-bed capacity hospital. Upon adding old beds from the previous facility, we now have 84 beds. However, we have had peak periods, especially at the maternity units. Pregnant women and post-op patients have on some occasions been compelled to be nursed in chairs. We also experienced the no bed syndrome. This has compelled us to rent mattresses sometimes in town. There is space available for more beds. We have empty walls and rooms that can take up this. So we would like to use this occasion especially to appeal for support to help achieve this. The power situation. The power situation in the facility has been a scary story. Despite efforts made by the local NEDCO office, and I must commend our district engineer, Engineer Arthur, for his cooperation with us, power within the district has not helped our facility. Currently, a radial line is used to transmit electricity to this district and Banda. So for every little problem, electricity supply will be cut. An attempt will be made to restore supply automatically. This leads to multiple on and off situations until this automatic restoration fails and human physical intervention comes into play. Nanache, the multiple on and off situations have led to loss of major equipment in the facility, despite attempts to even protect them with stabilizers. The oxygen plant and the X-ray machine are examples of such. Our oxygen plant is currently down, so we have had to turn to the old method of using oxygen cylinders. The stationary X-ray machine is also down, and so we are currently relying on the mobile X-ray machine. We have even recorded a fire incident at our emergency department because of such unstable supply. It is worth noting that here in Nsoko, once you see the clouds gather for rain, brace yourself. The lights will surely go off. Nanache, we have major medical equipment here that most district hospitals cannot boast of. Let's help jealously guard them. We would plead, even as the hospital prays that it will one day be granted a dedicated feeder line, the district generally needs a control room to help keep the power instability at bay and help reduce prolonged outages. A utility vehicle. Nanache, honorable guest of honor, as big as the hospital is, and the fact that we are the only hospital in Bono region that covers 2 districts, we have no utility vehicle. Official assignments, no matter how far, no matter how early officials need to report, are done with either private vehicles, which are all saloon cars, or even public means. We visit sub-districts, irrespective of how bad the roads are, with these saloon cars of our own, or rent pragia or taxis for staff. We are unable to cover Banda districts or join them for any major activity because we have no means. 2 staff members have had to bear the brunt as they sustained injuries from 2 accidents whilst on a trip to the sub-districts on these tricycles. Nanache, guest of honor, it is disheartening. A high purchase arrangement for a pickup 5 years ago was not delivered. We also unfortunately suffered audit queries for the undelivered vehicle, which we are still paying for. For the undelivered vehicle, because we were still paying for it. Nanache, distinguished dignitaries, we need help. In terms of accommodation, I must say, Nanache, with a staff of 253, only 25 have been privileged to be accommodated within the hospital. The remaining 228, irrespective of how essential their services are, how urgent the expertise will be required in case of an emergency, live a minimum of 30 minutes walk away from the hospital. This also means this number have to grapple with rent and daily transport. We have a vast land available thanks to the Nsoko Traditional Council to expand staff accommodation. We only need investments, either public or private. Nanache, if investment is put into accommodating our staff, we are sure that we will be halfway through incentivizing them and retaining a very good number. Even as we look at that, Nana, we plead. Let's consider granting staff, especially hardworking staff, discounted cost of land or even free pieces of land to invest in their accommodation.